I'm a physician. I'm also a medical school professor. And I've the book is it's titled Lies I Taught in Medical School. We'll talk about that in a minute. I mean, and the book is critical of Western medicine, Western sort of allopathic medicine. Although I have to admit, I'm a product of that system. I'm part of the problem. I still am. And even though I'm critical of Western medicine, I have to say that if I get hit by a car today, I'm going to want Western medicine to give me a blood transfusion, fix my, remove my spleen, fix my bones and all that. In fact, Western medicine transformed the world in the 20th century through all the pills and surgeries that were developed were nothing short of magical, and largely through public health measures, infectious disease and stuff. Western medicine truly made the world a much, much better place. Or allopathic medicine. It's not all in the West. It's all around the world. But sort of traditional allopathic medicine. And what the problem is, and what the book's about, and what prompted me to write it is in the 21st century, we're facing literally a tsunami of what are called chronic diseases. And these diseases, they existed in the 20th century, but nowhere near biblical numbers that we're seeing now. And these diseases seemingly are unrelated, all the way from obesity to diabetes to high blood pressure to cancer to heart attack, stroke, Alzheimer's disease, even mental illness. But as it turns out, they have a common metabolic cause. But the problem is, Western medicine, when they take the same pills and surgeries that were so effective in the 20th century and apply them to these chronic diseases, as they're doing, they work for the symptoms. In many cases, they can be life-saving in controlling the symptoms. But the problem is, in almost all cases, they don't get to the underlying root cause, the underlying metabolic abnormality. So even though the symptoms are controlled, the diseases in many cases continue to progress, and they go on and on and on. And that's what this book is hoping to address. And the way I got interested in this, I'd like to say, hey, I just wanted to make the world a better place. But no, I was doing fine. I was minding my own business in medical school, teaching, doing research, teaching young doctors and other healthcare professionals, and also practicing medicine. And I was going along when suddenly I came down with 4 of these diseases. And these diseases, these chronic diseases, they're common. Most adults have at least one of these diseases today, and the numbers are growing. But when I came down with these 4 diseases, I went to my doctor and I said, hey, help me. And they did. They gave me prescriptions. They gave me pills for each one of those. And, I'm curious. I said, hey, by the way, what about other things? Should I be doing other stuff? What about lifestyle? Does that really work? And they go, nah, that doesn't do anything. You're going to be on these pills for the rest of your life, so get used to it. And at that point, it made me really begin, out of self-interest, to question my beliefs about this and question what they were telling me. And I realized there's a whole body of research and knowledge that I wasn't aware of, and many of my colleagues are still not aware of, about how lifestyle does indeed transform us and can reverse, or at least slow down or push back, I would submit, all of these chronic diseases. And when I made some relatively minor changes in my own lifestyle, I was able to, when I went back to the doctors, they thought the machines were broken. They couldn't figure out what was going on with my labs, and basically I went off those prescription drugs. And now I've made it my mission to help others take back their health, and hopefully not make the same mistakes that I made.
Can I put you on the spot?
Sure.
Because I'm listening to what you're saying, and I see these posts, social media and whatnot, where they say doctors, pharmaceutical people, they're out there to keep us on these drugs for them to make money. Is that a misconception? Because it's maybe because, kind of like what you're saying, well, the doctors were taught one way and they're not looking at another, more so than, oh, the doctors know, but they're just going to keep giving us these pills so they can make money?
It's a great question, and it's a fair question for sure. I have to say, I believe in my heart that most people, including healthcare professionals and doctors, don't get up in the morning and want to consciously harm other human beings. I don't think it works that way. But I think the system is built so that there are both conscious and unconscious pernicious financial and other incentives that drive the advice we're given that isn't maybe the best advice for our health. And, like I said, it may not be what we need to reverse these chronic diseases or slow them down. I mean, my mom was a dietitian, a food person. So I was raised in that environment, but I was always struck when I would go to the dietitian meetings. They were sponsored by Coca-Cola and McDonald's, and it was basically the junk food industry that paid for and drove the education of dietitians who make our food recommendations. Well, it gets actually worse. The medical education today is driven by the pharmaceutical business, as you hinted at, so that a lot of things that doctors learn are shaped through the lens of giving drugs and pills and other surgery like that.
Kind of getting back into this as far as how we could recognize what we need to do, what we need to maybe ask our doctors, what can we do to better our health, and then to go into, how do we know metabolically if we are healthy or not?
Yeah, all great questions. It's interesting in metabolic health. There have been some studies that show that this underlying metabolic dysfunction, which manifests with several things like high blood pressure, which today most people in America have high blood pressure or are being treated for high blood pressure. Mm-hmm. It also manifests as your waistline, our waistline. So, but today in this country, most people are either overweight or obese. It also manifests as blood lipid abnormalities. Not so much the LDL cholesterol that everybody talks about with heart disease, which we could get into, but more the metabolic markers are HDL cholesterol and triglycerides, and also a marker for diabetes and glucose metabolism, which is the blood glucose. And studies have shown that over 80%, some studies show 90% of adults have at least one of these metabolic abnormalities. And most of them don't even know that they have these problems. And this gets back to something that was sort of, a wake-up call to me in writing this book. As a doctor, I used to visualize diseases like you either have them or you don't. And that's the way our healthcare system is set up. I mean, in order to be reimbursed for seeing a patient from an insurance company who has diabetes, they have to have a diagnosis of diabetes. And so there's a certain diabetes is an abnormality in blood sugar. So there's a certain threshold of increasing blood sugar. When you cross that, you are given the diagnosis of diabetes, and certain treatments are paid for now by the healthcare system. But it's interesting for this disease, diabetes, a week earlier, before your glucose was that high, you wouldn't have diabetes. And I used to think, well, you either have it or you don't. But now I realize that at least for the chronic diseases, that the ones we're talking about today, these diseases don't start when the doctor says, oops, you've got diabetes, or, oh, you forgot your keys. Well, we've done some tests and you have Alzheimer's, and I don't mean to make light of any of these, but I'm trying to bring the point home that it's not when the doctor diagnoses them, that there's very strong evidence now that we talk about in the book that these chronic diseases don't begin when the doctor diagnoses them. They actually begin years to decades before we get the diagnosis. Okay, so what does that mean? Well, if we wait until the doctor wait until the doctor tells us we have one of these diseases, we've missed a tremendous opportunity for treatment and prevention through lifestyle changes. Because a lot of people are saying, well, you know what, my doctor says I'm healthy, I don't have any diseases, I don't take any pills, I'm going to change my lifestyle, but I'm going to wait until I get a disease. And the problem is, we're all going to get one of these diseases. I mean, you and I and most of our listeners today statistically will die from one of those chronic diseases that we just talked about. I mean, the number one is heart attack, but we all don't die of heart attack. Some people die of Alzheimer's, some people die of cancer. But the point is, as Jim Morrison used to say, nobody gets out alive, right? I mean, we're all going to get one of these diseases. So, and now knowing the fact that they begin years to decades before we get the diagnosis, the prudent thing to do is change our lifestyle now and push back these diseases. I mean, why have your heart attack when you're 55? Why have it at 75? Why not have it at 105 or 120? So the idea is there's value in changing our lifestyle, even for those people who haven't been given a diagnosis yet by their doctor. And this is something that we were talking a little bit offline in the beginning, or I don't know if we were offline or not quite, but we were talking about the idea that the importance of the doctor versus the patient, and with information and Googling and stuff. And actually, I think we're entering a new era of medicine, which is very empowering. And even though I'm a doctor, I realize that doctors don't make me healthy. I go to a doctor to get less sick. If I want to be healthy, it's on me. And it's because it's through lifestyle that I become healthy. And lifestyle is something that a doctor can't do for me. There's no pill, there's no surgery for lifestyle. It's a choice that I choose to do. And furthermore, it's a choice I get to make every single day when I wake up. What am I going to eat? Am I going to exercise? How am I going to do it? And it's very empowering, because suddenly I am the CEO of my own health. And don't get me wrong, doctors are important, and we need to, pay attention to their advice. But ultimately, it's on me, and I have the agency to do lifestyle, which I would submit for most of us is the most important, most powerful medicine that any of us will ever experience.
Yeah, I've got some comments about this, because what you're saying really hits home. One of the 4 big chronic diseases. Yes, and I'm very familiar with the diabetes. But aside from that, I've been seeing more and more reports that they're talking about how younger kids are getting some of these chronic diseases more so than before. Adults are getting these chronic diseases sooner than what they used to. And then I started thinking about, all right, for the young kids, when I was in school, what I had for lunch versus what they're having for lunch now, whether it be school provided or from home. But the biggest thing to me is dessert back in the day was an apple. A dessert today on that tray in a lot of schools is some sort of high fructose corn syrup product, even though almost all the foods have that. But I think that's number one. The number two thing, too, is back in the day, I don't know your age, but I'm going to guess that we grew up in a time when PE, physical education, we had that in class and we did stuff. Today, there's excuses to get out of it, or they don't have it, so the kids don't get that much exercise. And then, like I said, lifestyle changes. It carries on into our teens and our 20s and 30s. We're used to just sitting there at a desk doing whatever it is. We're not doing that lifestyle to become or be more physically active. Do you think all of those, that combination of stuff, leads to a lot of these chronic diseases?
Absolutely. I mean, our food system and the recommendations for what is healthy to eat, which drives what they feed our kids in school, what they feed military veterans, prisoners, and ultimately choices around the world are made based on these recommendations, is something that something that the U.S. government has called the food pyramid. It's the food plate, but it was originally the food pyramid. We probably all remember the idea of a pyramid here, and the bottom of the pyramid is what you were supposed to eat the most of, and the top of the pyramid you eat the least of. And this is the model for a healthy diet. And Nina Teicholz is a doctor who famously just wrote an article. Sort of revealing that the most recent food pyramid recommendations from the government committee to design the food pyramid, that 90% of the people on the committee had basically ties to junk food makers. They were
ulterior motives.
And if you look at the food pyramid, actually, no surprise, the bottom row, which we're supposed to eat the most of, is all junk food. It's cereals and grains and empty calories like that. And this goes on at all levels. Our trusted scientific institutions are corrupted. The American Heart Association, which recommends seed oils as a healthy alternative, canola oil. If you go back in history, in the 1950s, they received millions of dollars, which essentially got the American Heart Association going, from a food company that in the beginning of the 20th century took a machine lubricant that was originally developed for German U-boats and other things. In this machine oil, they realized that they could feed it to people and it wouldn't kill them. And it was cheap. And they named it Crisco, and they made it like a butter substitute or a fat substitute. And today, they're all the seed oils that are industrial seed oils that are descendants of Crisco. But the American Heart Association recommends this. American Diabetic Association, trusted source for diabetic news or diabetic truth, on their website recommends for type 2 diabetics diets, recipes which are relatively high in sugar, and their advice is to, quote, cover it with insulin, which will keep the sugar spikes down and keep you from dying. I
got to throw something in about that, because you're so right as far as that part goes on type 2 diabetes, because I am a type 2 diabetic. And some of the healthcare providers that I've seen, they'll tell me, well, you need to eat this and that, and I'm looking at it going, this doesn't sound right. That's full of carbs, and that's not going to do me any good. But then they tell me, make sure you get your insulin and keep going up every 2 units if it's not working for you. Yeah, but they're not talking about lifestyle, but they're talking about alcohol, empty calories, junk full of carbs.
Yeah, type 2 diabetes is sort of the perfect example, because it, like hypertension, the other diseases, we're approaching almost half of people having type 2 diabetes or pre-diabetes. And, you mentioned children before. Type 2 diabetes used to be called, when I went to medical school, and it was called adult onset diabetes because only adults got it. But now children are getting this and everything else. But type 2 diabetes is sort of a model for this thing, because the American Diabetic Association, which is the scientific institution about that, their recommended treatment for type 2 diabetes is it's a number of drugs, starting with metformin and going on eventually to insulin. And these drugs, make no mistake about it, they are life-saving. If I'm a diabetic and I get a spike of my blood sugar and I don't get insulin, I will die if it's high enough. So insulin is life-saving. But an interesting thing is present that a lot of people don't talk about, that we go through in the book with a lot of references, is that the American Diabetic Association considers type 2 diabetes as a chronic progressive disease. In other words, you control it with insulin and you won't die of hyperglycemia, high blood sugar, but you're going to continue on to get other things. What kind of other things? Well, diabetes is the number one cause of surgical amputations in this country. Chopping off toes and feet from diabetic ischemic neuropathy and ischemic vascular changes. What else? Type 2 diabetes is the number one cause of renal failure and dialysis. And a big sponsor of the American Diabetic Association is DaVita Corporation, which is a major player in the dialysis market. What else? Alzheimer's disease is referred in many circles to as type 3 diabetes because of the there's dysfunctional glucose metabolism in Alzheimer's disease, and people with diabetes have much more Alzheimer's. They have much more cancer. They have much more heart disease. All these things increase with people with diabetes. And by controlling it with insulin, it doesn't really, it's still a chronic progressive disease. You get all these other things. Okay, well, if that's what it is, it is. Well, it's not that simple. There is an alternative. And there have been controlled prospective studies that show that type 2 diabetes is a problem with carbohydrate metabolism. Basically, that's one of the food groups. And they've shown by restricting this particular food group in what's called a low carbohydrate diet, they've shown that for many people, and the majority of people, type 2 diabetics, on these diets, they can reverse their type 2 diabetes to the point where the majority of them actually get off insulin and they get off their drugs. So what does that mean? Well, the people who reverse their type 2 diabetes with diet and lifestyle, they change their type 2 diabetes from a chronic progressive disease that has all those other things to something that is, what do you call it, in remission. You're not a diabetic anymore. You will be a diabetic if you go back and eat a bunch of carbs and sugars and everything. Those people will go right back to doing it. But by controlling it with diet, the majority of people can get off their drugs and actually stop their diabetes. This is type 2 diabetes, which is over 90% of the cases. Type 1 is a different issue. But this is not communicated through the American Diabetic Association. You know, it's not their number one recommendation. And the fact that these differences occur, I don't believe are being communicated nearly enough. And I mean, you could take a cynical view and say, well, you don't sell much insulin if you cure the people of diabetes, and if you're a dialysis company, you don't want people to get off their diet, and again, to our previous conversation, I don't think people intentionally want to harm others, but these are the factors that are at play here, and it gets very, very muddied like that, and that's one of the issues. This plays out in the other diseases as well, in different fashions. But that's kind of the model of the thing, that give it pills and surgery, we save their lives, but the chronic disease progresses. If we do lifestyle, in many cases, we can stop the progression. In some cases, even reverse the disease where they get off the pills. And that's what I believe is not being communicated well enough by the Diabetes Association or the healthcare establishment in general.
So let me ask you this then, because a couple of things that you mentioned early on is, well, I'll put it this way, is you go to the doctors and maybe you are a diabetic. You don't know it, but the doctor doesn't check because you're there for something else. You're there for a general physical checkup. So does that mean that we should be aware of, or if we have some concerns, to ask the doctor, the physician, or our healthcare providers, can you check this for me? Can you pull the blood work to check this? Is that a good idea to do? Sure,
you can ask them. The go-to test is called a hemoglobin A1C, which is a simple blood test, and the higher it gets, when you cross a certain threshold, you become pre-diabetic, and then when you cross another threshold, you become diabetic. Mm-hmm. And another change in thinking I had in writing this book, I used to think that with diseases like diabetes, you either had it or you didn't have it. Now, it may be starting years before, but you're still going to get it, right? And some people get it, some people don't. Well, there was an interesting study that we talk about in the book that came out. It was a large population study in the United States of adults who don't have diabetes, and non-diabetic adults, from databases like the Framingham database, and then another one called the NHANES database. And what they showed was fascinating, is that they looked at non-diabetic adults and their hemoglobin A1C levels, which is, again, the blood marker for diabetes. The higher it is, the worse it is, right? And when it crosses a certain point, you now have diabetes. And what they showed was these non-diabetic adults, the older they got, their hemoglobin A1C got higher and higher and higher and higher. What does that mean? Well, that means that, if I can get back in there, what does that mean? That means that that type 2 diabetes, it sort of changed my thinking of it. It may be something like more like gray hair. In other words, if I don't die of something else first, I'm on the path to type 2 diabetes. And I believe that maybe not every adult, but the majority of us are on the path to insulin resistance, which is what type 2 diabetes is, and it increases with age. So again, that's another reason to adopt a lifestyle that is going to protect me from type 2 diabetes. And the great thing about the lifestyle is this lifestyle, this metabolically healthy lifestyle, not only helps me from gaining weight, it also helps to reverse my type 2 diabetes. It lowers my risk for cancer. It lowers my risk for heart disease, stroke, Alzheimer's disease, mental health issues. The same lifestyle covers all the bases for these metabolic disease. It's wild. It's completely unexpected.
Can you give the audience a clue as to what this lifestyle looks like? Is it a diet? Is it exercise, sleep, all of the above? But can you kind of give us a clue as to what this lifestyle is?
Sure, and that's the key point. I mean, when you say lifestyle, it means many things to different people. And if you say, hey, should we adopt a healthy lifestyle? Well, of course we should. Should we adopt healthy eating? Well, of course we should. But no one's going to argue with that. But the challenge is different people think of, what's healthy. We've already talked about differences of opinion about seed oils and other things like that. Well, the same thing applies to lifestyle. So it's your question is really important. What are the valuable things? Well, what I believe is important, and certainly what worked for me, and what the evidence I think supports, is it comes down to four things. And most people, there's a lot of consensus around this. First of all, nutrition. And that's they're changing what you eat and when you eat also is probably number one, but it may not be. Number two is sleep. Not only sleep quality, but sleep quantity. Elon Musk says he gets by with 4 hours. I used to be on call 24 hours a day carrying a pager, and I had crazy sleep hours. I thought I was helping my patients and being a tough guy, but I was actually being stupid and hurting myself and hurting my patients. It's not good to get irregular sleep. Some of us have to work nights, but we want to protect our circadian rhythms. And it turns out most people need between 7 and 8, 9 hours of sleep. And if you get much less than that or much more than that, bad things start happening. Metabolic dysfunction, heart attacks, all those things go. So that's sleep, part two. Third one is exercise, both mental and physical exercise. If you're over age 50, you should be lifting weights. You should be strength training if you want to live a long time. It's so important metabolically, so important mentally. And I think of all my, my physician friends, if they're not orthopedic surgeons, very few of them are lifting weights, but it is so important. It's really underappreciated, especially the older you get. Old people should be in the gym lifting weights. And then finally, the last one is arguably, it may even be the most important, and that's stress and mindset. And stress is it's chronic stress is one of the big drivers of all the chronic diseases, of inflammation, insulin resistance, oxidation, all these things that drive all the diseases we talk about. But stress, it's interesting. Stress it's not like people think of it. A lot of people says, oh, he has a very stressful life, or she has a very stressful life. Well, that can be true, but the interesting thing about stress is not a result of what happens in our lives, but it's rather the result of the meaning that we assign to what happens in our lives, whether we consider it to be a stressful or non-stressful event. Well, what does that mean? Well, let's say somebody can go in for cancer surgery in their pelvis, and it's a big operation, and they get opened up, and it's very stressful, and it's hard on them. You could take another person that's going in for nearly the exact same operation, and it will be a joyous event. Why? Because it's the birth of their child through a C-section. And the meaning they assign to all these things is a positive one. It's like some people go out in the rain and it starts raining and they just get angry and, oh, my clothes are getting wet, they're getting ruined. Whereas somebody else will start dancing in the rain because it's a joyous thing. You know, I mean, California, we need rain except for the mudslides, you know, but that's the interesting thing. So and you know, out of fairness, we don't always get to assign meaning to everything. It's not in our conscious control all the time. It goes back to our childhood trauma, which we all have, unfortunately, and how the reality that we see is produced through the lens of everything that's happened to us in the past, and how we look at the world, how we have a sense of purpose. In other words, do I get up in the morning and look at the world as a dangerous place that's about to hurt me and full of pitfalls and things I need to avoid? Or do I get up and look at the world as a place of love and opportunity and generosity and abundance? And it's the same world. We're all living in the same world, but we see it through our own lenses. And to some extent, these lenses can be changed through different therapies and different things we do. And to the extent we can change these lenses and we can change the stress, we can lower the inflammation and lower the effect of seemingly unrelated things like Alzheimer's disease or cancer or these other drugs. They are indeed related to our perspective, our sense of purpose, and the world. So those are those are the four main lifestyle things.
Well, you know, the four main lifestyle changes, or what we should be doing, is simple enough, but oftentimes it's so hard. Like I said, it's a matter of, you know, getting enough sleep. Well, don't stay up all night and watch TV. You know, change that. Start reading the book an hour before bed or half hour before. Set a time. It's easy enough to do. It's just a matter of turning it into a habit and making it something that you do all the time. Exercise, or, you know, lifting weight type of thing. You said the older you get, you want to lift. Well, if you don't have any weights, you don't have to use weight. You can use your body weight. You know, as a senior, part of that, I think, is get up out of your seat. I tell my mother this: stand up, sit down, stand up, sit down. That is using your body weight that you have. Do that every 30 minutes. If you're sitting there watching TV, you're doing weight resistance. Don't just say, oh, I'm pedaling this pedal thing. I said, there's no resistance really on that, so you're not doing anything, not even for your cardio. But there's, again, it's so simple to do, but it's so hard to start and maintain.
Yeah. Yeah. I mean, you know, you and I, we've been hard on the medical profession, right? Of pills and surgery and everything, but I'm going to put on my patient outfit now. And as a patient, I have to say, if I go into my doctor and I have a problem and he says, hey, or she says, hey, guess what? I'll either give you a pill, which you'll have to take once a day, or I'll give you a surgery, which you'll have to take off work for a week, but then, you know, then you're back to regular. Or I'm going to give you a lecture about what to eat and lifestyle. And a lot of people, they would prefer getting a pill or the surgery even, rather than having to change who they are. Because lifestyle, it's not just 1 minute a day in the morning when you wake up and take the pill. It's literally changing your being, changing your existence, changing the way you look at the world, changing what you eat, changing when you sleep. It's a bigger ask, and unless people really buy into it, they're gonna go, no, why bother? And they need to understand that lifestyle is important. It matters. It's a big deal. It's bigger than any of these pills or surgery, because none of these pills and surgeries can reverse metabolic disease the way that lifestyle can. You know, all the insulin in the world is not going to cure a type 2 diabetic, but guess what? Going through a lifestyle change, they can. And that's a huge thing.
And I think, like you said, on that number 4, and you said, well, maybe this is the biggest one. And I believe that it probably is. Sleep is way up there, you know, number 1, number 2, but that mindset, that change your mind about how you look things. I always refer to stress as a silent killer because stress comes in many different forms for all of us. We don't know what it does on the inside because you can't see it, but I mean, you can really feel it when you're stressed and what it does to your body. So I think with that change of your mind, like you said, a rainy day, one person's going to be grumpy and say, this is great, what a terrible day, and then the whole day's terrible. Somebody else can go, oh, wow, my plants are going to get some water. They're going to grow. Wow, cleans out the air. This is great. Live in Seattle. You'll have a different attitude.
Yeah, and it's important to balance, and we're all different. You know, that this lifestyle plan, but it works across the board, but we need to keep an eye on them. You know, you have some people that they get their diet dialed in perfectly, you know, and they get their exercise. They're at the gym. They're doing they're learning languages. They're playing instruments and stress. You know, they meditate every day, and the world is a beautiful place, but their sleep is out of whack. You know, they have disordered sleep. That's enough to throw them off the metabolic one or any one of those pillars. We have to do all of them, really.
Yeah. Well, I just want to make sure that the audience knows where they can go to find your book. So if you could give us the rundown on your website. Once again, the name of your book. I see it's behind you, but if you can give us all that stuff, because we've only scratched the surface about this, I think, and we've really just, you know, our main talking points have been around type 2 diabetics, and I don't want people to think, oh, this is a show on diabetes. No, it's not. This is on your lifestyle and how you can change to be healthier. So can you let us know where they can go?
Yeah, sure. My website is robertlufkinmd.com, just my name with the MD. And you can actually download the first chapter of the book if you want to see if you like it in audio and PDF form. I'm also active on social media, so please, if you see me, say hi.
Yeah, again, for the audience out there, I'm not a healthcare professional or anything like that. I have no education in it, but I do have one of the chronic illnesses, and it is, I will say personally, that it is a difficult thing to change whatever bad habits that you have, but it's a necessity to change those habits if you want to have a healthy lifestyle and if you want to be able to have a good, long life. Because I don't want to live a long time and be unhealthy the last third. You know, I'd like to be healthy all the way through.
Yeah, absolutely. Yeah.
Any closing thoughts for motivation for folks out there?
Well, just kind of to emphasize what I touched on before is that, you know, it's a new era of medicine. I'm excited about being a patient and taking charge of my own health, and it's a new world we're in where we get to decide what our lifestyle choices. Every morning when I wake up, it's a new day, and those choices, we can begin implementing them today for the rest of our lives, and I find that very empowering.
Well, I'm going to say do what you're doing right now. Smile. Smile at yourself when you first wake up and look in the mirror. Dr. Robert Lufkin, MD, thank you very much. This has been really beneficial for me, and I hope it's beneficial for the audience out there, for all the viewers, the listeners. But I do believe that this is a really good starting point for people to listen to you.
Thanks a lot, Chuck. I appreciate your conversation and questions.
Thank you.